Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. We're here today to give the community the most up-to-date information available about the COVID-19 pandemic. This press conference is broadcasting on county TV and on the county's YouTube YouTube page. This meeting is being interpreted in American Sign Language by Joe Black. A Spanish language translation is being produced by Just Communities Language Justice Network and will be available on the county's website and YouTube page shortly after we conclude. Yesterday, the national social distancing guidelines were extended at least through the month of April. The devastating health consequences and financial impact of the coronavirus is now clear to everyone. We must all focus our efforts on stopping the spread of COVID-19 here in Santa Barbara County. Fortunately, the state of California was the first state in the nation to enact a statewide stay-at-home order. This aggressive and early intervention has given us more time to slow the spread of COVID-19. There are a large number of people infected with COVID-19 in our county who have not been tested. More positive cases will be reported, and more people will require medical care and hospitalization. At this time, the best tool we have to reduce the local rate of COVID-19 infection is the same strategy being used throughout the world, practicing good social distancing. This strategy will work if we all do our part. I know most people are doing the right thing. We want everyone to get needed exercise. It's very important for our emotional and physical health. If you're strong and healthy, you have a better chance of protecting yourself from the worst consequences of infection from COVID-19. We are simply asking everyone to be smart about our current situation. For example, if you want to go hiking and see a lot of cars at the trailhead, try shifting to walking in your own neighborhood. There are many wonderful things to discover in every neighborhood, and you have a much better chance to keep social distance with the space available on a sidewalk than a single-track trail in the foothills. I'm sure many of the people watching this press conference have now memorized and are practicing the simple steps we must all take to stop the spread of the coronavirus. Santa Barbara County is a large place. Not everyone has heard or is acting on the message, so we need to repeat it patiently and consistently. We must all take individual responsibility to protect each other by carefully doing a series of simple steps to stop the spread of coronavirus invisibly in our community. The first is stay home. If you have to go out and run an essential errand, stay at least 6 feet away from people. Regular exercise is important, but try to do it in your own neighborhood and keep 6 feet away from others as you pass on the sidewalk. Continuously wash your hands during the day and regularly disinfect high-touch surfaces. If you're feeling sick, isolate yourself at home and treat your symptoms there. If you believe that your symptoms may indicate that you have COVID-19, there is no reason to panic. Most people will be safe at home in isolation. If your symptoms get worse, call your medical provider or the public health clinics. Your doctor will be able to tell you over the phone what to do next. If we all consistently follow these simple steps, we can slow down the local spread of the virus. This will allow time to preserve and expand our local healthcare system to be ready to treat the sick patients who will require hospitalization. In closing, I'd like to highlight the efforts of a local service provider that is responding to COVID-19. Family Service Agency is continuing to reach community members during this time. Family Service Agency is providing their family and senior support programs over the phone. They are also continuing to provide mental health services for local school children and seniors through telehealth. Through the support of organizations like FSA, our community can continue to serve those in need during this time. To learn more about these services, please visit fsacares.org. That's fsacares.org. Thank you. Next, I'd like to introduce Dr. Henning Ansorg, the county's public health officer. Dr. Ansorg?
Thank you, Supervisor Hart. Good afternoon, everyone. Let me give you our latest lab report. Today, we are reporting 20 additional cases of COVID-19, bringing our total case count up to 88 in Santa Barbara County. The ages of the new cases range from teens to over 70-year-olds. Of the new cases, 9 are in Santa Maria, 1 is in Orcutt, 6 are in the North County unincorporated areas, including city of Guadalupe, 3 are in the city of Lompoc, including communities of Mission Hills and Vandenberg Village. 1 is in the city of Santa Barbara. Of the 88 confirmed cases, 49 of them are recovering well at home. 19 already have fully recovered. 14 are in the hospital, 10 of them in the intensive care unit. The increase in numbers is very typical for a virus that spreads quickly from person to person. We expected a doubling of cases within 3 days, and that is almost exactly what we are seeing. It is an indicator of just how infectious this thing is. Our team of experts at the Public Health Department has been planning and thinking ahead over the weekend and has come up with scenarios of what to expect for the near future as it relates to illnesses, hospitalizations, and healthcare needs in Santa Barbara County. The increase in numbers of infections that we do see corresponds really well with the pattern seen in the rest of the nation and even worldwide. What we learned when playing out best and worst case scenarios was this: the only definitive factor which makes a substantial difference between the best and worst case scenario is how much community members stay physically isolated from each other. Continuing with our current efforts of social distancing will make all the difference. It will mean that our healthcare system will be able to meet the high demands we are expecting, and our hospitals and clinics will be able to take care for the sick. This is reassuring. I thank everyone again for taking such good care of yourselves and our community. Having said that, I couldn't help but notice that on Sunday, while I was driving through my neighborhood, there were several large gatherings in private houses, likely extended family get-togethers or parties, as well as occasional dining at some locations which clearly is in stark disregard of the statewide stay-at-home order. If you are meeting up with local family members or friends, either at someone's home or a restaurant, I urge you to discontinue these behaviors. Discontinue gatherings immediately. They are not safe at this time and can lead to the unintentional spread of illness. And if you're a food vendor or a restaurant manager, please do not encourage gatherings while your patrons are waiting for takeout food. And please do not provide seating to invite this kind of behavior. All people, regardless of why they are outside, should maintain the 6 feet distance between themselves and others. Also, we see that certain areas of our state and nation have become hotspots of infection. It is heartbreaking to witness the overwhelmed hospital situation in New York, for instance. There's a domestic travel advisory in place for the tri-state area of New York, New Jersey, and Connecticut. I strongly urge everyone to limit all unessential mobility to the highest degree possible in order to prevent the spread of the virus from and to other areas. Again, thank you all for helping our community to get through this crisis as best we can by practicing physical distancing and good hygiene at all times.
Thank you, Dr. Ansberg. Next, we'll have Joyce Dudley, Santa Barbara County District Attorney.
Thank you, Chair. You know, the people of Santa Barbara County are unique in 2 very clear ways. They care, and they're very resilient. And we don't just care. We actually, our caring is commensurate with our actions. And so, because I know you care so much, it's important that you understand the kind of in-home crimes that are happening right now in our county. And when I say in-home crimes, I'm talking about domestic violence, spousal rape, child abuse, elder abuse, and animal abuse. All of those crimes are happening now. And what makes now unique? Why do I believe that there's an increase of those crimes right now? It's because people are under a tremendous amount of stress. They're in their home, they have alcohol and drugs within arm's reach, and they're frustrated and anxious, and they don't know when the end is going to be. They don't have the end in sight about when they're going to go back to work, when their children are going to be able to go back to school. And all of that tension and all of that frustration can lead to violence. And if you're in one of those homes where you are being abused, or your pet is being abused, or elders, or your children, you have to call 911. And why do I emphasize how important it is that you call 911? Because those caring people in Santa Barbara County can't see into your home. They can't see. The teachers, the clergy, your friends, your neighbors, your family, only you know what's going on in your home. And making that call is so important. And if you're a perpetrator of one of those kinds of abuse, you need to leave your home. You need to go someplace where you and your family and friends can be safe. It is so critical that everyone takes this action now, because these crimes are going to be underreported. And I can tell you that I've talked to the sheriff and all the chiefs of all the law enforcement agencies in this county, and they're going to respond to those calls. And if you need help, the chair just spoke about the Family Service Agency. What a great place to call. Or if you're not sure who to call 211. But the one thing you can't do is stay home and abuse, and you can't stay home and be an abused victim. Make those calls. The other thing I mentioned was how resilient Santa Barbara County can be. In the years that I've lived here, drought, fire, debris flow, mass murders, the one thing you can count on is that Santa Barbara County will come back. And as hard as this seems right now, this is just temporary. And we're the county that can do it. Santa Barbara County cares, and Santa Barbara County is resilient. Thank you, Chair.
Thank you, District Attorney Dudley. We'll next go to questions here in the room. Who has a question?
Okay, I have one from my news director, and he says, for those deemed fully recovered, is there an effort to get antibodies from blood plasma to help treat others? Is it a trial being attempted in other parts of the county? Dr. Answorth.
Dr. Answorth, please.
There are ongoing tests at the CDC level on these blood tests, but they are not ripe for prime time at all. I was just on a call with the CDC, and we discussed this issue. There's, for instance, a finger stick test, that's actually produced up in Santa Maria, but those tests are not reliable, unfortunately. They do cross-react with other coronaviruses, so at this point, this test is not ready for prime time.
And lastly, do you see a reason that Santa Barbara has now gone ahead in numbers than slow?
Well, we're not actually going ahead in numbers. We are doubling over a 3-day period, which is, the mathematical norm. So sometimes lab test results lag behind, and the numbers may be different in like 2 hours. So I'm actually not sure what SLO's numbers are as of today, but I would believe that it will even out if you just take a week or something and just extrapolate. It should be a nice curve. Not so nice, actually.
Yeah, that's a good point. There have been a number of questions about the timing of numbers that we release here in Santa Barbara County. And I think one thing that is helpful is that we are doing these regular press conferences at a set time, so we collect the information and are able to present our information at a set period of time. There are different reporting schedules for different entities in different parts of the tri-counties. There are also different reporting numbers coming from the hospitals. Our numbers are verified positive cases from Santa Barbara County at this point in time. So the numbers are consistent day to day, but there are variations amongst all the different reporting entities.
Could any patients here that are well end up on that Navy ship, the Mercy?
I guess the question for Dr. Answorth.
A patient who is well?
Well, for example, the Mercy's here to take the load off of other hospitals in LA. The USNS Mercy just.
Well, somebody's, well, they're discharged home.
I don't mean this case, but if our hospitals here get full, in Los Angeles, they brought in the Navy ship, the Mercy, as a hospital for people with other illnesses.
Yes, I understand. The Navy ship is like a huge help for LA County. It will have hopefully close to 1,000 or maybe even 2,000 beds available, which will be a great relief. But our numbers here are, of course, smaller than Los Angeles. You know, they're talking 10 million people. And when we combine San Luis Obispo, Santa Barbara, and Ventura, we are looking at 1.5 to 2 million people. So it's very different. So our surge capacity doesn't have to be as large. I think Los Angeles is in dire need of those beds, and I don't think they can spare any for Santa Barbara. We have to find our own solution.
Any other questions in the room? Delaney, would you please use the microphone? Thank you.
I have a few. One, I apologize if you already said this. Last time you updated us on ventilators, we had 32. Have we gotten any more in?
I'm not sure about the exact numbers of ventilators. I'm sure I am sure that it's way more than 30. And
Wait, okay, because last week it was 32.
no, I don't recall that number. I don't know what you're quoting. Maybe one hospital alone or the whole county, but
At least that's what Dr. Van De Reynoso said last week.
I see.
All 5 hospitals in the county. She said there's 32 and we were expecting more on the way, and I didn't know if we ever got them.
I see. Well, I do know that that number is too low. I do not know the exact number that we have. We are in the process of procuring much more. We do have a cache at the county available that is being, what do you call that, refurbished and, you know, refreshed for use if needed. And the state is actively procuring new ventilators as well, and hopefully we can access those caches once we need them.
Do you know what that process is? Or do we get them based off of need? How does the state decide which counties are going to get them? Is it just solely based off of need or county actual size?
I'm not exactly sure how it is decided, but it is definitely the main important factor is the need of an area. Also, take into account that not every area is at the same stage in this infection. For instance, the Bay Area or Sacramento area are way ahead of us, way ahead, it's like 2-3 weeks ahead of us.
Mm-hmm.
In these times, that's way ahead of us in numbers, you know, and so I can't make a prediction how those ventilators are going to be distributed, because we're expecting a large number of ventilators to be produced actually also.
Okay. And then another question, Governor Newsom said a few hours ago that they have this new platform for medical workers, whether they've still getting their degrees, they're retired, trying to bulk up our medical workforce. Is Santa Barbara County going to have some kind of local campaign to get more people on board? We have a couple nursing programs in town. Are people from there going to be recruited?
Yeah, Governor Newsom was really proactive in this, and I commend him for that. We do have a Medical Reserve Corps, and that is activated. So we have a lot of nurses and doctors already working with our EOC and our Department Operations Center, and we are very grateful for their service, and we are ready to expand that even further. I've gotten multiple phone calls from local colleagues who, you know, all expressed their wish to help, and I have a list of phone calls I can make and take them up on those offers.
Awesome. And then one more. It's kind of for you, Greg, even though it's not your district, and this might not be the place to ask this. But there's been reports that Deltopia is still going to go on this weekend, and that students are still trying to make that happen. Does the county have any kind of plan to stop that, close the beach or something for a weekend? That could be thousands of people potentially gathered.
Well, the simple answer is that that's completely inappropriate, and we do not want that to happen. And I know the folks, the elected members of the Isla Vista Community Services District are working with the community to encourage people to follow the social distancing recommendations. We will redouble our communication efforts to discourage that. You know, the national message at every level of government, you know, is trying clearly to communicate, stay home. The idea of coming here to celebrate in that kind of way is, you know, completely inappropriate and irresponsible.
Totally.
And we do not want that occurring. And the Sheriff's Department will be prepared in the event that that begins to happen.
Okay, cool. That was my question. Thank you.
Any other questions in the room?
One more for
Yes, Tracy.
District Attorney. There's a lot of erroneous things going along on the internet. Is there anything you can say for people not to share some of this stuff that is sort of just trying to get into your internet?
What a good point. And I have to say that I'm one of those people that shared bad information. I got an article from a friend of mine, maybe some of you got that same article about the belief about Stanford. I think I even shared it with my good friend, the chair of the board. And then 2 seconds later, I got an email from someone saying, that's not accurate. So this is the best thing to do. If you read something, do not believe it at all until you Google it. And then sometimes if you Google some of the words in it, you will find out it is just another scam. I think that it's just critically important that you listen to our local doctor, our health officer. He's here, he understands what's happening in our county, and don't get caught up in other stories you hear from other websites, because we have no idea if any of them are accurate.
Thank you. That's exactly right. That's the reason we're having this press conference, is to give clear, accurate, verified, up-to-date information. And those sources from the internet that are not vetted by local news media who are here getting this information directly are suspicious.
Quick question.
Mr. Dreyfus?
Yeah, Steve Lavanito posted today that Santa Barbara County received 1 million mass donations. And is that true? And if so, how long will that last?
I think that is true, and I think that was an allocation from the state of California through their distribution process. And how long that will last depends on how many patients we have. And those masks are being allocated through the county's process that has been a collaboration of all of the local health providers, the hospitals, the health clinics have all worked together to create a process whereby those resources are fairly allocated to the different parts of the county and the different medical needs of the county. And it's a very collaborative process that we're quite proud of having created. Any other questions in the room? Let's go to the phone lines. Gina?
Yes. First up, we have Tom Bolton with Newshawk, to be followed by Reza with Santa Ynez Valley Star. Tom, go ahead.
Thank you. I have a couple of questions. My first one is for Dr. Ansord. You indicated that you and your colleagues developed some scenarios for, where this thing is headed, best case, worst case. I wonder if you can share some of the details of that, the numbers, expected patients, expected hospitalizations, et cetera.
Yeah, I'm not at liberty to disclose those exact numbers. Those are really just planning models that we have to use, and the data are just not robust enough to distribute this as, it was the reality. We just have to have something to go by with our planning.
Well, maybe a less specific follow-up then is, do you expect this doubling that's going on right now to continue for some period of time? And if so, what might that be?
Yeah, I asked myself the same question. That looks pretty scary if you really do the math. And that's why I cannot emphasize enough. I mean, if we look at New York City, to me, it's just heartbreaking. Such a vibrant city, and all of a sudden, you have I don't know how many they are. I look at the Johns Hopkins website, and every hour it jumps up. It's just horrific. So, yes, the mathematics of this virus is vicious. So the only thing that we have is social distancing. I don't know how often I have to say it, but it is really the truth. It is unfortunate, and that's how Korea got it under control. It's unbelievable. They stuck to 10,000 cases and a few hundred deaths only. And Italy has more than 100,000 cases now. It's, you know, it's really scary. So the mathematics look scary, and I don't want to scare anybody, but I want everybody to take responsibility for themselves and for the community and stay home. Thank you.
And then an unrelated question. I'm wondering, and I'm not sure who this actually is to, but I'm wondering how well you feel the social distancing and other advice messaging going out is reaching the Spanish-speaking community. Anecdotally, we're seeing and hearing that some segments of that community may not be either getting the message or embracing it. And I'm just wondering how successful you think you are in reaching those people that do not speak English.
Well, we are trying to communicate this message aggressively in Spanish. This press conference is being translated into Spanish. The Santa Barbara County Public Health website, all the materials there are translated in Spanish. The Public Health Department is working with UCSB on specific outreach strategies to communities that have different languages in Santa Barbara County. And it is very important to have trusted messengers and other local governments and other nonprofit community organizations working with the disadvantaged communities in our county to spread the word in every language possible. The simple, repetitive steps that we have mentioned over and over again today is the message to all members of our community, and we really need help from everyone in the community to follow these simple steps. Stay home, wash your hands, keep 6 feet of distance away from people, and take this very seriously.
I guess my question, though, Greg, is how successful do you think you've been?
I don't think we have a metric that measures that in the larger community or the Spanish-speaking community. And I think there are folks who are doing a better job than others. And it is important to remind people who are not doing such a good job to do a better job.
All right. Thank you very much.
Thank you, Tom. Any other questions on the phone?
Yeah, Raisa from the Star, go ahead, followed by Malia with Santa Maria Sun.
Great. Thank you so much. I really appreciate everything you guys are doing to get the information out here. Just want to be clear. And Dr. Ansorg, you said that there had been 6 new cases in North County from yesterday to today. Were any of those from the San Ynez Valley at all? And I also wanted to know, at the San Ynez Valley Cottage Hospital, are they prepared over there to either transfer patients or treat any patients there?
Yeah, I'm happy to answer that. The reason why we don't give details about small communities is due to privacy laws that we have to follow.
Right.
And so I'm not, at liberty to disclose really exactly in which location those new patients were, but I can assure you that the San Ynez Hospital is part of Cottage, and Cottage has a really solid program in place, and they transport people who need intensive care to the Santa Barbara site or to Goleta site, and they are well prepared. They have daily meetings, disaster, meetings, and they are a fantastic partner in this fight.
My next question is, the patients that have recovered or are recovering, are there any certain medications that are being prescribed, or any, are they drinking apple cider vinegar and lemon? Is there anything that people can do home remedy wise, or if there's a specific type of medication that you're seeing is working well as opposed to another one?
Do you mean for preventing the illness or once you've recovered?
Well, I mean, once they're, confirmed with COVID, is there any specific type of medication that they're using, or any home remedy that they might have been telling you that they're using at home to help with their symptoms?
Oh, I see. Yes, usually people use very similar home remedies or over-the-counter medications that are used for other virus illnesses, like severe colds or so forth. We do not have any antivirals that work unfortunately. There are a lot of studies currently ongoing to find a cure, but unfortunately we don't have one yet. So what people are doing is anything between Vicks VapoRub and Tylenol and so forth. And what I would like to stress is that to keep your immune system as strong, as healthy as possible, as Supervisor Hart already said, get some exercise, eat well, drink plenty of water, get rest, those things, laugh if you can, make yourself and each other laugh, because it's really important for the immune system. And the stressful times, I cannot stress this more often. And anything that helps us boost our immune systems is good for us. And we will recover better if we were to get sick.
That's a great prescription, Dr. Answorth. Other questions?
Thank you.
Thank you.
Thank you, Raisa. Malia, go ahead, to be followed by Laura with Santa Maria Times.
Thank you. I'm wondering how hospitals and first responders are doing with having enough personal protective equipment. I realize there was, as you mentioned, the large amount of new masks in the county, but I'm wondering about other PPE measures like gowns and gloves, especially for first responders like firefighters. I know there were some firefighters who had been quarantined after a potential exposure, so I'm just curious about first responders.
My understanding is at this time, we have adequate supplies for first responders of personal protective equipment. And we are continuing aggressively to get in line with the state's allocations of that equipment. And we've been very fortunate to have generous members of the community who have contributed to that as well. And there are people who are working feverishly at home to sew personal protective equipment that could be used in a supplemental way with the official equipment that is being delivered by the state. So at this point in time, we have sufficient supplies, but we are trying to stay ahead of that as we are trying to stay ahead of the patient positive infection curve as well.
Mm-hmm. And it's my understanding that the firefighters were let out of quarantine. So just to confirm, that patient that was suspected to have COVID-19, they must have tested negative if the firefighters are no longer in quarantine, correct?
That is correct.
Thank you.
Thank you, Malia. Go ahead, Laura, with Santa Maria Times.
Thank you, Gina. So I'm wondering regarding I believe you said 1 million new donated masks that I believe you said are from the state. I know that on March 3rd, Governor Newsom's office announced that there would be millions of masks distributed to areas in need throughout the state. So is this allocation of masks for the county from that initial announcement earlier in the month just now being allocated, or is this a new set of mask donations being sent out by the state?
We are ordering masks from the state's distribution system, and those are being fulfilled in part. Our requests are not always completely filled by those requests, but as soon as we get a distribution from the state, we are asking for additional supplies and are continuously keeping our requests at the top of the queue. So we're getting as many masks locally as the state is able to deliver to us to meet our needs.
Okay, so for this 1 million group of masks, is there an expected date when those would arrive to the county, or are they already there and being processed, like you said?
I don't know precisely where they are, whether they're physically here yet or on their way, but we will have them as an asset for our residents.
Okay, thank you very much.
Looks like there are no more questions on the phone.
All right, well, thank you all for being here. Thank you for listening in. If you would like additional information about COVID-19, please visit Santa Barbara County's Public Health's website at publichealthsbc.org. There is a new dashboard on that website that gives detailed information about the status of the number of tests that have been administered, the number of current positive cases, and it is broken down by geographic area around the county. It's an easy to see graphical interface that's new to the website. So if you have not seen that, please visit publichealthsbc.org. And we also are continuing to staff the live call center number, which is 833-688-5551. The Santa Barbara County Board of Supervisors will be having a presentation from staff on COVID-19 tomorrow morning at 9 a.m. that will also be broadcast on the county's television stations and posted to the website afterward. So thank you again, and we'll be back for a press conference on Wednesday at 4:30.